Carmen, thank you so much for joining to the Flawless Growth podcast. I am super excited to have you here. I would love to start asking a little bit about what sparked your passion in community advocacy and public health.
Well, first, thank you so much, Maria, for having me on the podcast. It's
Absolutely.
always exciting to talk about what motivates us to do this work
Mm-hmm.
in any aspect of wellness. Sometimes I look back on my childhood and I think about my adult career and I wonder if I just failed at rebelling against my parents because I'm a second generation community organizer. I grew up as a kid. I remember being in the back of a lot of community meetings coloring. I was on my dad's back in a backpack when I was a baby at City
Aw.
Hall when he was active. And my parents were both performing artists and creatives, dancers and musicians. I grew up in Austin, Texas. So, like a lot of people from here, I came up among people who were attracted to this place because of the creativity
Okay.
and movement and
Yes.
physical movement, community movement, all of those things. And uh, so my dad's entree into politics was actually through cultural arts funding and trying to get more accessible cultural arts funding for independent artists and non-white artists.
Mm-hmm.
And I was little bitty when that was happening. Also, when a lot of Austin's land development was being negotiated in the 80s, um, I was kind of born into that. And so I got exposure to community organizing really early. And then also my mother, who I'm the youngest in my family,
Mm-hmm.
and I'm the youngest of three daughters who were pretty spaced apart.
Okay.
So my daughters are my daughters, my
My
sisters
sisters.
are 7 and 14 years older than me.
Wow.
So when I was born, my mom was 37, a very fit 37. She was still a dancer, and she was also working most of my childhood. But she went back to graduate school. She went back to school when I was a small child, and she actually got a master's degree in kinesiology and exercise science. She started teaching aerobics, which she did for 17 years throughout pretty much my entire childhood and adolescence. And she oops, gotta love when technology interrupts your podcast. But she also she went back to school again when I was in my pre-adolescent years and got a PhD in nutritional sciences. So she was really on this, and her doctorate was really about her PhD was about uh, lovastatin, which was a cholesterol drug, and CoQ10, the enzyme, which is still very popularly talked about. And if you think about like in the mid 90s, these were really big statin drugs and enzymes and supplements and their interaction,
Mm-hmm.
especially the relationship with alcohol. So that was like very sciencey, and I got exposure to the lab. But in terms of just everyday nutrition, what I saw was my mother exploring her own health problems and her own wellness issues, and having a lab partner who was Syrian American, and also a former athlete who combated really difficult health problems through nutrition and looking at cultural knowledge of cultural staples wherever you come from. There's like a history to the food of where you come from and how that interacts with food and medicine now. So that really like showed me the power of how you can control your wellness by understanding better your relationship to food, your relationship to fitness. But it also was just, it was around me. So I think I took it for granted. And
Yeah.
I got into community organizing really around environmental health and environmental justice issues. But when the recession hit and when I had to, work 3 or 4 different organizing jobs,
Wow.
and I saw that a lot of interest in public health, there was money in fighting childhood obesity and getting at the root causes of health disparities. And I found that exposure, both to the environmental justice movement, but also like just seeing how health could be applied in so many different ways, um, it gave me a set of tools to get into population health organizing, and I've been doing that ever since.
Oh, that is amazing. Not, like you continued a little bit of your family's path, which is great because a lot of people don't. They're like, oh no, they're so tired of seeing their parents do that, and they're like, no, I don't want anything to do with that. So I think that's amazing.
Yeah, well, my parents definitely they were already fighting the mainstream. They're very outside of the box people.
Yeah.
And I don't think I noticed how outside of the box. I mean, I really grew up with like poets and sculptors and
Beautiful.
researchers and people, just really all kinds of interesting people in Austin, and that has given me I think that's given me a strength in being able to relate to people at any
Hmm.
level, and to also learn that like you can be doing any mundane job for your but you might have some really interesting passion outside of that that
Hmm.
can connect you back to your own wellness and your
Yes.
own self-interest, right?
And super important to follow that because even today in society, like people say, oh, you're not going to make money with that. Or, oh, you should study a real career, like things like that. It's very common. So I applaud you for following it, and we should encourage people to do it. Or if you're struggling, then have a real job and like a regular job, and then also follow your passion, have a side hustle or something like that, and then you can make it your own, your full-time thing.
Hopefully.
Yeah.
That's what they say, right?
Yeah,
Do
hopefully.
what you love, the money will follow. And I think we're in a time right now where financial resources are being, you know, drastically moved around, changed,
Hmm.
sometimes often by forces outside of our control. So I think even now it's more important to find like where can you work, do what you love, and resource yourself and find ways of wellness that aren't
Hmm.
necessarily connected to your full-time job, because we may be losing that. A lot of folks have already lost that security, so
Uh-huh.
a lot of this is meeting people where they're at.
Got it. Yeah, agreed. Okay, and can you tell us a little bit more about Austin Vamos? What they do?
Yes. Yes, go Austin, vamos Austin, or GAVA. Lots of people call us GAVA for short. So we are community organizers breaking down barriers to healthy living in what we call Austin's Eastern Crescent, mostly the Austin's north and southeast sides, although we work with neighborhoods all over the city. And we specifically focus in communities that have been disproportionately impacted by negative health outcomes. Now, that can mean all kinds of things, but the organization, we actually started as a childhood obesity intervention in
Mm.
2012, and it was actually a project of the Michael and Susan Dell Foundation of in Dell Computers, and Dell has contributed a lot to child health and population health efforts in Central Texas,
Mhm.
and abroad, but especially in Central Texas. And so GAVA was one of these projects to look at bringing together multiple community partners and residents in specific, to begin with one specific area of Southeast Austin where for very high. We think about this as kind of the mid 2000s, Michelle Obama's Let's Go initiative. There was a lot of focus on trying to get at the root causes of chronic health problems earlier in children's lives, because we were seeing that a lot of kids were showing up with type 2 diabetes and chronic
Mm.
disease risk factors, right? So this is very true in the neighborhood of Dove Springs in Southeast Austin. But a lot of potential for organizing to kind of take galvanized its ability to advocate for things that they didn't previously have, like a library, a recreation center, more services for their youth. And so it was
Mhm.
kind of, the pump was primed for a new organizing initiative to really bring people around together around access to healthy food
Mhm.
and access to physical activity opportunities and promotion of these things from a community owned place, not just telling people you need to move and eat better, but actually saying what gets in the way of you getting fruits and vegetables, what gets in the way
Mm.
of being physically active. And so, really, what we were doing was addressing social determinants of health in these neighborhoods. And in the first 5 years, and with multiple partners, we were able to leverage tens of millions of dollars of infrastructural improvements. This is parks, playgrounds, lighting, soccer fields.
Oh,
It's
nice.
also looking at food retail options, starting
Hmm.
the city's first healthy corner stores initiative, getting healthier staples in corner stores where there are not access to grocery stores, but also starting neighborhood farm stands and alternatives to get affordable fresh produce that weren't going all the way to a farmer's market far away from this neighborhood where a lot of folks were mobility challenged. And
Mm.
so that opened up a lot of community based efforts that looked all kinds of ways in schools and neighborhoods. And
Okay.
we spun off as an independent organization in 2018. We also moved into North Austin neighborhoods at that time. And over that time, I will say I didn't found GAVA, but I did start working very early on as a community organizer, and I stuck around and took leadership positions. Eventually, we changed this into it's always had community organizing, but we really focused it on organizing with people from the neighborhoods and people who live in the neighborhoods who really can understand what that lived
Right.
experience is like trying to live a healthy lifestyle. And we took into account other issues that have intersected with this. This is the well being of childcare providers, those who care for babies 0 to 5 years old,
Hmm.
especially in home based and informal care environments, which
Hmm.
is where the majority of our kids are. So, not just looking at like, oh, are they getting healthy programming and food and activity? Yes. Do they have shade over their playground so they can get outside? Do their
Mm.
providers have what they need to provide consistent care? Who's actually advocating on behalf of the workforce behind the workforce? And how are we building a movement now of childcare providers who advocate for themselves and each other, so that they can be healthy, so they can have healthy childcare environments, so their families can have access to healthier lives? It also intersects with climate change.
Mm.
Our neighborhoods in Southeast Austin were hit by catastrophic floods in the first five
God.
years of our initiative twice.
Oh,
So even
wow.
though we did have increased access to healthy food and physical activity, even though people were using those things, they also experienced a community trauma that impacted their health.
Yeah.
And those, as we all know, are happening more frequently. And so because our areas of focus are disproportionately impacted by flooding and heat, which are probably the two biggest health stressors and
Hmm.
shocks
Hmm.
facing Texas climate wise,
Hmm.
we started applying that same methodology of organizing that we use to get better parks and playgrounds and healthy food, to getting better drainage infrastructure, better disaster preparedness,
Mm.
protocols in place. How do you make sure that people are able to continue taking their medications,
Yeah.
have access to medical equipment, right? Are able to maintain the diets they need in times of shocks and stressors. And we also look at neighborhood stability because our neighborhoods are getting heavily gentrified and economically displaced.
Yeah.
So we are working on both advocacy around land use policies that support the healthy built-in environment and affordability and anti-displacement. Also working with folks on long-term visioning for community land trusts and affordable housing so that you can have permanently affordable mixed income neighborhoods that also benefit from these trails and green space and playgrounds and healthy food access points that we've worked so hard to get. So we do a lot and
Wow,
it
that is
changes day to
beautiful.
day. Yeah, but it all comes back to making sure that our health outcomes are one day no longer predictable by our race or our zip code or our
Yeah.
language spoken or immigration status, right? And ensuring that people have the shared leadership and skills and networks to care for themselves, each other, and to get access to the things that do improve our quality of life.
Mhm. And do you feel that people are open when you guys go and try to explain a little bit about what you do and the initiatives? Do you feel they are pretty open to it, or it's been a little bit hard to maybe change their mindset or make them understand?
Hmm. I think, well, first of all, everybody's a little different,
Yeah.
but we've engaged probably 3,000 residents in these areas over the last decade and a half, if not more.
Mhm.
And I would say hundreds of those folks have stayed engaged for years. Um, I don't say those numbers lightly because it's not like these aren't client served. Like,
Mhm.
we don't provide just programs or benefits. We're actually engaging and building relationships with people and saying, what is getting in the way of your health? oh, you know what? Your neighbor is also facing this. Are you
Hmm.
interested in getting together and seeing what you can do about it? When you get five people together and they can understand that the barriers they're facing are actually faced systemically by their
Hmm.
neighbors and there's something they can do about it, once they engage in that, especially if they get a win, they get that new sidewalk, they get that new playground. Maybe it takes years, but you see
Uh-huh.
it. But in 2 weeks, you can change the meal plan at your kid's school, or you can start a walking group that makes a difference immediately. Like that changes you forever.
Hmm.
Like
Hmm.
people's agency, now they know, like, oh, I actually can change this. Um, I think sometimes people have a feeling like, well, shouldn't the government be doing this? Or shouldn't an
Yeah, that's what I
organization
thought.
already be doing this? Or like, I'm arguing for trash cans at my park. This is a basic need. I'm not asking for something extra,
Yeah.
right? And sadly, there's also that like recognition that a lot of times the things that we need, almost everything we love in our communities was created by somebody or fought for by somebody. It takes advocacy. So I do think that sometimes there's a little bit of resistance there.
Hmm.
And also like people are tired, there's pressures, right? People are
Right.
busy. That said, the reason we're able to get people to respond is because as organizers, our job is to listen. It's really to ask questions first.
Yeah.
And so if we can understand what's motivating people and then we can connect that to other people's motivation,
Hmm.
then they're not doing it for us. They're doing it for them.
For them.
And maybe for some people, yeah, you can't convince someone to take care of their health.
Right.
Everybody has to make that decision.
Hmm.
But also only each of us can tell how that's going to work for us.
Hmm.
And so the trick is having that curiosity and being like, what are you finding? What do you want to do? What would it take for you to go and do that thing?
Hmm.
What if you had and sometimes that's a beautiful gift. That's a luxury to have a moment with somebody where you can just imagine, what if things were different? And what
Right.
if I didn't have to do it by myself?
Yeah. In community. Beautiful. And how is the you guys' relationship, let's say, with the government? Because, for example, if you guys want to build a park, you might have the money, but there's needs to be permissions, I'm guessing. Is that an easy relationship? Is that something that takes very long? How does that work?
Um, yes, it takes a long time. But we've done it. I've watched community move mountains with parks, and it's a never-ending thing. Like because it's not just getting a park right; it's maintaining a park.
Mm. Hmm.
When we started doing our work in Dove Springs, there was a lot of park space that was just neglected. There
Hmm.
was nothing there except grass growing. There like we actually were able to get a massive master plan to transform a pocket park from a triangular strip of grass to having a playground, play fields, lighting, an actual recreational space that now serves an entire mobile home park, a early childhood school, and the elementary school across the street. Um, and it did take about 5, 6 years,
Oh, wow.
uh, but it was public land, and so yeah, when it's public land, you have to work with the parks department, and the parks department usually needs help. I mean,
Hmm.
they're underfunded.
Yeah.
They have limited staff.
Yeah.
They need the support of volunteers who help to maintain spaces. They also need the eyes and ears of the public to say, "Hey, like," and I think what we've uh, a challenge and a success we've had with that is that, like, community engagement takes time,
Hmm.
and we don't expect city departmental employees to check in with community members about every single thing they're doing. But when they make big decisions about capital expenditures, like big amounts of money they're going to spend on projects, we've had for example, one park where the community spent hundreds of hours surveying their neighbors, getting exactly the priorities they needed for this park. And then when a piece of money came available, the park was ready to put in, an upgraded playground or an upgraded drainage system to the park. When they said that the drainage system, we know that's important, but the playground, if you're going to give us a fancy playground, it really doesn't matter because after 5:30 in the winter months, we can't use it
Hmm.
because it's too dark because we don't
Hmm.
have lighting. So
Mhm.
we'd rather have like the existing playground we have and
Right, with
get lighting in
lighting.
there so we can use the park, and then we can talk about, upgrading.
Yeah.
And so that ended up becoming like a negotiation of
Mhm.
like, how are we going to spend that money? Yes, we want these upgrades, but we need you to make basic changes so that we can actually use the park. And if you're not in the community using that park, you don't see how dark it gets. You
Yeah,
just don't know that's a priority, right?
exactly.
So, and if the people who can see that the best don't necessarily speak your language,
Mm.
then we're sort of that bridge builder where we're building up the leadership of community members to advocate to the institutions and leverage resources, and also working on the institutions to be more adaptive,
Yeah,
responsive,
right.
attentive to these leadership needs, right?
Uh-huh.
And that's kind
Uh-huh.
of how we get stuff done. We have to hold our city folks accountable, but you can't really have accountability without support. So we
Mhm.
also have to be building up leadership to participate. We can't just bark at them what we want. We have to really guide each other together and find the resources to do it.
Yeah, 100%. Sometimes it's not that they don't want to, it's just that they're also underfunded, or that maybe they just haven't realized that there's such a need. Sometimes it's just that they don't have all the knowledge, and by getting together and helping as well, because not everything should be taken care of by the government. We need to do our part as well. It's when we can grow things.
Yeah, it's a both and.
Yeah.
We need investment in these public assets, and I think that's a lot of our work too, is advocacy around where do our public resources go and how do we access them.
Hmm.
But a large part of it is building the social structures and the organizations and the community leadership to leverage outside resources too,
Hmm.
and to
Correct.
to synergize that. Right, it's not one or
Yeah.
the other.
Yeah. Uh-huh. And how do you guys usually measure success?
Great question. So I always like to say there's process and outcome,
Uh-huh.
right? So in process, we measure a lot of well, we set milestones with the community. So there are certain goals and objectives that are developed. For example, right now we're supporting the launch of a food cooperative in Del
Mhm.
Valle in Southeast Austin. That has we worked for 2 years to organize with people in 4 languages
Wow.
all over the city. Yeah, we had meetings sometimes with interpretation in English,
Oh,
Spanish, Arabic,
wow.
and Pashto,
That's so
along
cool.
with folks reaching out to Vietnamese speaking communities. I mean, particularly since we moved into North Austin, which is much more ethnically and culturally diverse than some of our other areas,
Mhm.
it's really pushed us to go beyond our bilingual capacity and
Yeah.
really engage, which is amazing because then what do we get out of that is that like one of the Pakistani members of the steering committee is an agricultural engineer
Oh,
in his
wow.
background, right? And so we're planning a food cooperative with potential for growing food on the land. We
Uh-huh.
have real expertise that
Yeah.
might have been looked, completely overlooked, had we just been looking for somebody with the stats here, because
Right.
there are a lot of professionals in our community who can't apply their expertise in our
Mhm.
system, but they can in a community space where they're creating something. So now I have to remember the actual question that you asked me, but in terms of like in each of these projects, we have like created some opportunities for people to pursue. Okay, yes, we want access to healthy food.
Yeah.
This neighborhood needs produce. There's another neighborhood that might have distribution capacity, but let's take it a step further because we also want people to be able to sell their prepared foods in this cooperative. We have a lot of folks who have cottage food certification or who could get cottage food certification. Now they can actually have a source of revenue
Mm.
for healthy prepared meals that are culturally accessible to more folks in our community, right?
Mhm.
Um, so that's one way. But remind me the
Yeah,
actual
yeah.
question you asked
So
me
it
because I
was
had a thought.
you were talking about the process, and then how do you measure success?
Yes. So from a process standpoint, um, how many people are we developing leadership from? Are we like, okay, we've identified now several projects here. Like, what is getting the produce? What is the cottage food stuff? What is distribution?
Mhm.
And so setting objectives around that by when do we want to have what achieved. So those those milestones are set by community, and so we're measuring our progress against those wins. How quickly
Mhm.
are those things getting achieved? How many
Right.
people are we engaging? How much leadership are we developing? How many people are calling meetings on their own now? How many teams are established? Those are some quantifiable metrics
Mhm.
that we can put on there. And there's a lot of qualitative stuff about where do people feel in their agency and their leadership, right? On the outcome, then we look at what is the ultimate impact of these things once they're
Mhm.
established.
Mhm.
Some of that can be done through community surveys. We have a surveying process going on in our early childhood work now that
Mhm.
is going to be surveying informal care providers who don't typically get um, they don't get surveyed. This
Right.
data doesn't usually get picked up from this population,
Uh-huh.
and so we can. And in our early years, we had a lot of elaborate public health studies set up that actually had longitudinal studies with pre and post test surveys that showed that people were not only increasing their access to healthy food and physical activity, but
Mhm.
increasing those behaviors.
Mhm.
Um, Now we don't look at body mass index. Back
Okay.
10, 15 years ago, they were looking a lot at BMIs and they
Uh-huh.
actually measuring, and we actually showed that we stabilized adult BMIs in among the people who were most engaged in our efforts at a time
Okay.
when BMIs across the city and state were going up.
Oh, wow.
There's a lot of
Nice.
caveats with that kind of measurement, but we still are interested in looking at outcomes measurement and partnering. Another way to look at this is with clinical partners.
Mhm.
So, where that food co op is expanding, there's also a new clinic. There are many patients on the county program for healthcare who are also introduced to other resources, right? Is it possible to look at clinical outcomes for some patients who are trying to manage their diet or
Mhm.
have more increased access to healthy food and can have maybe a subsidized membership to that cooperative or more access to that? Can we look at some clinical
Right.
um, measures, whether that's clinical data or patient activation measures, to show what is the impact of actually having this asset in your community?
Mhm.
But I think truly there are a lot of outcomes that are hard to measure.
Right.
And we're always looking at new partnerships. We also do a lot of partnership with researchers at the University of Texas to find other outcomes. Climate resilience is one of those. How prepared do people feel before and after an event?
Mhm.
And we've seen great results in the areas where we've done a lot of our disaster preparedness metrics. But
Oh,
since
so
our
nice.
capacity is limited, we have to partner with people who know how to really collect and analyze data well.
Of course, you guys cannot do it everything.
Well,
And
I do have two masters in public health on my team.
oh,
And our deputy director, even though her main job is to make sure all of our internal systems, HR documentation works, she also is a longtime evaluator and has an eye for research and measures and
okay.
accuracy. And so we've really used that relationship to find additional ways to measure our outcomes in meaningful
Mhm.
ways.
Perfect. And from all of your career, what's been or one or two of the most rewarding moments?
Mm.
So many.
That is, yeah, that's a hard one. I think, there was a time when we were able to partner with the Dell Medical School and some community soccer coaches.
Okay.
And we had developed some soccer programming for children who weren't able to afford the formal soccer programming. So, especially if you have multiple kids, right? But
Mhm.
getting a soccer league started and run by the community years ago, that only charged like $1 to $5 per child.
Oh, nice.
And then partnering with Dell Medical School to get resources to send hundreds of children from Southeast and Northeast Austin and Del Valley to the Univision tournament. And
Oh.
getting to see them like participate in a huge tournament
Uh,
and seeing kids find a lifelong love for soccer. Definitely that's one. Also, seeing the first produce stands and produce delivery. Um, we had a produce delivery program that we developed in partnership with community out of a vision in November of 2019. And then, what happened in March of 2020, we thought we would have to pause some of our programs, and the food
mhm.
distribution program just accelerated. It went on full tilt. delivering to 20 families, then 40 families, then 60 families.
Mhm.
And keep in mind, while this was a time where a lot of people were out of work and
Mhm.
emergency aid was needed,
Mhm.
by 3 weeks in, every single one of those participants was paying for their produce. So it
Oh,
was sliding
wow.
scale, but everyone was buying. And this became like a standing program. We've since handed it off. It's to another nonprofit. It's still
Okay.
going strong. It's paying local delivery drivers to deliver local fresh produce
Oh, I love
at a
it.
sliding scale. And those are moments when, it feels like so many systems are collapsing, but you see
Mhm.
opportunity in crisis. And you have to remember that most of the people we're working with have beat the odds or had to outsmart, the way
Right.
things are going. And we find a way. And so it's been really cool. And the fact that now some of those leaders have been involved in the starting a food cooperative. Again, against the grain, starting a business is difficult.
Yeah.
Starting a cooperative business in a capitalist economy is difficult.
Yeah.
And doing it in an under-resourced community at a time when, there's targets on people's back.
Right.
It's all against the grain, and yet they're doing it. They're going to launch it this fall, and it's going to be a beautiful thing. And so I think those are the things that just really inspire me. As stressed out as I might get, it is making a difference, and little by little, we're getting there.
It sounds it is. It's amazing. Especially in a country where things are so processed. Just going back to a little bit more of that natural local economy. It's something that I definitely think that not just these communities but all communities need right now, because there's that issue of the of obesity in the country that is growing and growing.
Yeah, like I didn't get to ask you much, your background, Maria, but
Yeah.
like all of us come from backgrounds where we have some interesting relationship with food
Hmm.
or with movement. And I think we've gotten into a place of like for a long time, nutrition was just about like, oh, people don't eat the right things. And so we need to
Hmm.
teach people to eat better.
Right.
And I think at heart, most people know I should be eating more fresh foods.
Yes.
I should be eating, I should be getting my protein. I can't be eating fast food all the time.
Yeah.
Sure, some people are locked in, but for the most part, like our own traditions and cultures, what our grandmother fed us, most of us have
Yes.
healthy roots there that we can tap into, and that can actually be a source of joy. It doesn't have to be something that weighs us down.
A
It
hundred
sounded like you have a
percent.
grandmother recipe that you love.
Yes. So I am from Colombia, and it's just very common here to just eat very natural foods, or for example lunch, it's like what I call it a real lunch, which sometimes is different from America, that it's a sandwich or something out of a package. But here, no, you have your soup, you have your protein, rice, vegetables, water or juice. It's just and like it's also very you sit with your family to do it. It's
Yes.
very different. Like I would see, like my boss just eating in his when I was in another agency, like eating in his desk, just like some chips, and that was it.
Yeah, when really taking the time for the meal.
Yes.
And I went to Bogota in 2011. I got to have sopa y seca,
Oh,
el
nice.
corrientazo.
Yes.
I think it is brilliant,
It
like
is.
that complete meal, right? Which
Yes.
is definitely, and also that even if it's a fast time, you
Right.
have this moment, right? A
Uh-huh.
sit down where you're very mindful. And I think that's something a lot of us have lost and are trying to
Yes.
get back in our day.
Correct. I think it's super important. Even I would say that's important even for digestion, being
Yeah.
mindful that you're eating. Um so
Yes.
yes, but
And
I
if
am
you want to get scientific about it, they say 90% of the serotonin you need is made in your gut,
wow,
right?
look at
So
that.
our physical wellness is so tied to our mental and vice versa.
Mhm.
Thank you for sharing a little bit of your
Absolutely.
cultural connection.
And it's something that I'm in the States, sometimes it's hard for me how things are very heavy, you know. Even
Hmm.
protein, like here I can eat two pieces of chicken. Over there, I can't even finish one. And I see that difference a lot with not just protein, but other stuff. And so I really think that the system over there needs to be a little bit more natural because that's the main issue. It generates a lot of profit, yes, but it's not being good for the people.
Oh, if we had another hour for this podcast, I would want to go into soil quality,
Oh
which is
yeah.
where like nutrition and climate stuff also intersects for us. But
Hmm.
that is, a world of quality of our food as food gets more expensive, more folks are looking at growing. And so I think we do have an opportunity in front of us amidst all the crisis. We have even more motivation to get
Yes,
creative and to dig into some of that knowledge.
I agree. I do see a very big movement of people opening up and talking about this and being more conscious. So I think we're definitely going back to the roots. Okay, Carmen, let's
Absolutely.
talk a little bit about digital marketing.
Mhm.
Given the nature of the business that you work with, how do you use digital platforms to one create awareness and second to grow the business, like getting donations and getting more partnerships and things like that?
Well, I guess the most basic piece is our website,
Mm-hmm.
which was just refreshed
Nice.
earlier this year, and I'm already ready to refresh it again because no, it's beautiful. I love it. We worked with a firm called Inspirare, which does amazing bilingual work
Oh,
locally with
cool.
us, and actually worked with us to create a children's coloring book, a storybook,
Um,
to promote our early childhood work.
mhm,
So that is available digitally, but it was also a printed version, and has been a really cool way to engage families and children into the narrative work around childcare and caretaking.
mhm,
Um, but our website is probably that first place people see us and can see the work we do, but also see the teams of community people that we support on the ground and their individual initiatives. We use all the typical social media
mhm.
platforms. I think we have a huge growing edge on communications. I mean, a lot of our digital communication is internal and community based in terms of digitally communicating with the dozens or hundreds of resident leaders in various projects we're doing. How
Mhm,
we market it to the rest of the world, I think we can keep expanding. We've worked with
mhm.
filmmakers to make three beautiful short films about the people we serve. They're not your typical NGO nonprofit promotional films. They're
Okay.
more like narrative stories that artistically stand on their own, that really talk about the people and the issues that they face. And then we wrap those around with more interactive community events, and digitally, the way we present those, has the
Mhm,
context around them.
mhm.
Um, but so much of our work is face to face and in person. And I think we're
Ah,
always trying to do a better job of telling those stories and capturing it digitally for a wider audience.
totally makes sense. Like, of course, you cannot ever lose the person to person, but it does help because it's kind of like having a 24/7 person that does the work without getting tired and without getting sick.
Yes.
Okay, and have you guys done so apart from social media, website, do you guys do any types of like paid ads?
At the moment, we don't have any paid advertising. We have only put sponsored um, ads out when we were, for example, recruiting um, for a community board or a particular
Mm,
time sensitive opportunity to engage.
uh-huh.
Um, but to this day, I don't think we maybe in the years ago for a fundraiser. I would love to revisit it because I think we could
Yeah,
do more
a
to
hundred
reach
percent.
people. I also think there's an appetite to support community organizing right
Mm,
now, and
I
we need the
agree.
support more than ever.
Yeah, I agree. I don't know if you knew, but Google offers for nonprofit. They have a program. It's called Google Grants, and they give you $10,000 on ads for free. Of course, you have to apply, and they have to accept you, and it's a process. But it's $10,000 that you can do with campaigns that help you get more people into your website and get donations and etc. So that's something that you guys also could look into.
It was one of the first things we did when we incorporated,
Oh,
although we
really?
probably could go back and refresh since we have, refreshed our website, make sure we're getting your full benefits.
Right. So you started it and you posted?
I believe we still, well, we had the 10,000 because we were fiscally housed, and then we spun off in 2018.
Mm-hmm.
So I sort it was sort of one of those things I took for granted. It's like it's just always there.
Right.
But are we taking advantage of it is really a good question to ask my team.
True,
So thank
true.
you for the reminder.
Of course, because sometimes what happens, I've managed some Google Grants accounts, mostly for like animal rights companies, and sometimes it's a little bit hard to spend the whole 10,000 because they give you some limitations for grants accounts specifically. So a lot
Hmm.
of the times you have to know kind of like a lot of tricks to be able to take that account and to be able to spend the 10,000. Because sometimes you
Yes.
can only spend like 1,000, 2,000, and then you're like work on it more and more through time. So one day you can arrive to that number.
Yeah, I think we probably started and could pick that thread back up.
Yeah, you should. Okay, and for what's do you think has been the biggest challenge for you in regards, well, for the company in regards to digital marketing?
Probably the dedicated staff time. I think nonprofits are often under resourced, and we
Mm-hmm.
are included in our communications,
Mm-hmm.
marketing, and PR.
Right.
For a long time, there's been a sort of stigma against money going to things that are not direct programs and services. And so the majority of our funds go to personnel and to also to
Mm.
contracting. Um, People and organizations in the community who do really great work. And
Mhm.
so, we have a supplies budget. Uh, we have some budget that goes to communications, but we don't have a communications director. We don't have a
Right.
marketing and PR person.
Right.
That duty sort of shared across our team. And
Mhm.
so, skills are great. Toolkits are great. We can do a branding toolkit.
Mhm.
But I think that's probably where we struggle the most is having a coordinated, not just a strategy, but somebody on that strategy to lead it at all times.
Right.
And so that's typical. I think you see it in a lot of nonprofits.
Yeah, yeah, I see it. I've had there's one that they just had to stop the advertising because they didn't have more. They had the 10,000 that Google gives, but they weren't able to pay the fee anymore, like my fee, because of they didn't have enough money. So it's something that they'll probably revisit. So I do see it in nonprofits, but it's part of growing. It's part of
Hmm.
the. Okay, Carmen, thank you so much. I learned a lot. You were awesome to talk with. Can where can people know a little bit more about you and about the business?
Sure. You can find us on the web at goaustin.org. I always like to joke that the Global Alliance for Vitamin A beat us to GAVA.org. So that's why we have such a long domain. But at least it's a nutrition effort, right?
Right.
But here I am promoting them. No, but go Austin, vamosaustin.org. People can find us on Instagram and Facebook at, I think our handle is just Go Austin Vamos. But also, if you look up GAVA, you'll find us pretty easily.
Mhm.
We're also on LinkedIn and Facebook and all of those. And so we do love hearing from folks, stay in touch. And especially if you or any of your people are in these neighborhoods or you know people in Austin, in the Austin area, we'd love to connect.
Beautiful. Thank you so much.
Thank you, Maria. What a nice surprise invitation.
Absolutely. Love talking with you.